Thank you for listening to Depictions Media Radio. Welcome to Policy and Rights, the show about government policy and human rights. Welcome back to Policy and Rights here on Depictions Media Radio. We are going to hear from David Eby and Adrian Dix on the topic of recruiting more doctors into British Columbia. It is a problem for a lot of people to find a healthcare provider and an adequate doctor so that they can keep up with the symptoms and other things that would go along with healthcare. Recently, they did extend a new vaccination law that would require all wellness providers also to, if they're licensed through a college of education or any type of certification that would be needed, that they extended that so that all of the wellness care providers would also have to be vaccinated for COVID-19 as their healthcare counterparts, healthcare provider counterparts are also vaccinated. So let's listen to how Adrian Dix and David Eby plan on recruiting more doctors into British Columbia.
And today's MC. Before we begin our event, I'd like to acknowledge, of course, with respect, the traditional ancestral territory of the Coast Salish people to be here on their lands today. I want to introduce some of the people who are with us today, in particular, my colleagues in the legislature, Aman Singh, the MLA for Richmond Queensborough, MLA for Richmond South Centre, and MLA Kelly Green, from Richmond Steveston. As we share some important news, all of these MLAs have been strong advocates for the very things that announcing today. It's also a great honor for me to introduce Graham Kierstead, KC, the Deputy Registrar of the College of Physicians and Surgeons, who's with us today in the audience. We're very honored to have Graham here for the college. They've done very significant work. I just want to introduce first the guest speakers today, Premier David Eby, of course, Dr. Ramneek Dosanjh, the President of the Doctors of BC, and Dr. who will join us virtually today, a family doctor currently working at the Arbutus Family Medicine Centre Clinic in Victoria. In September, we announced a Health Human Resources strategy, which has 5 actions to strengthen British Columbia's health workforce and build a stronger healthcare system for all of us. Today, I'm very glad to be here as we announce some of the next steps in moving forward with our plan. And with that, I'm honored to Premier David Eby.
Thanks very much, Adrian. It's an honor to join you on the traditional territory of the Coast Salish people. Thank you for the introduction, Adrian. Colleagues here today, and friends from the medical profession and the regulator as well. Our shared goal today, as every day, is to make sure that every British Columbian gets the care they need when they need it. The pandemic really exposed some of the challenges in our healthcare system and gave us additional challenges in how we deliver healthcare. The strains that it placed on the system resulted in too many people finding a family physician, among other challenges. I certainly hear that out in the community. As many of you will know, my wife is a family doctor. And so many times people ask, what is she taking new patients? And we'll talk about the challenges that they not having a family doctor. And I see it in her work. I see what she does for families, how she connects them to the healthcare system and to experts in medical practice. I understand the urgency that British Columbians face and why they need a family. What BC is experiencing is not unique to our province. Healthcare systems across the country are under this kind of stress. Now, some are proposing, to respond to this stress, that we undercut the principles of universal public health. They promote a pay-as-you-go approach, allowing the wealthiest to jump the line to the front by buying their way to the front of the line. It's not right. Buying your way to the front of the line doesn't solve the line, it just changes who gets. Universal public health care is one of Canada's great achievements. Everyone deserves the best possible health care. We can't privatize our way to a better healthcare system, and we can't cut supports and get more doctors. Makes sense. The pandemic also taught us that going alone doesn't work. If we're going to solve these problems, we have to find them together. Patients in British Columbia deserve the best, whether receiving primary care through that family doctor, healthcare system, with a doctor, nurse, medical staff, or getting acute care in a hospital for complex, critical, and chronic illnesses. We're making those investments in hospitals and acute care clinics. We're making investments in nurses and other healthcare workers. We've revised the funding model to encourage more family doctors to practice in our province. While many are challenged to find a family doctor, we actually have family doctors who are trained outside of Canada who aren't able to practice family medicine in British Columbia. They lack a pathway to be licensed to practice here. Now, when I was in Chilliwack on the leadership campaign, I was hosted by a doctor and his wife, a dentist, and they both worked for the local school board instead of working as in their trained profession. Pathway to practice. We need to fix this. That's why we're taking action to get more internationally trained doctors off the sidelines and into clinics where they're so desperately needed. Today, we are expanding the practice program. This will make it easier for family physicians trained internationally to be licensed to practice in British Columbia. The program will triple from 32 seats to 96 over the next 2 years. As well, by working with the College of Physicians and Surgeons of BC, other international medical graduates will qualify as associate physicians. They will be able to care for patients under the supervision of an attending physician at an acute care facility. We are also working with the regulatory colleges to ensure international medical graduates can start the accreditation process before arriving in the province. And the College of Physicians and Surgeons of BC will prepare bylaw changes to allow doctors trained in the U.S. for 3 years to practice medicine in community settings, including caring for adult and pediatric patients, as well as providing emergency and urgent care. These changes will be implemented in the coming weeks with the intent to allow these doctors to practice medicine in BC by January. Every step we take gets us closer to our goal. We're working hard to create a British Columbia where everyone can build a good life. I am dedicated to making sure everyone in this province gets the health care that they need. I would expect no less for my family or for yours. Thank you very much.
Thank you very much, Premier Eby. The steps we're taking to removing barriers for more internationally educated doctors to join BC's health system are going to make a big impact. We know our province needs more physicians in the short and in the long-term care. And these actions, historic actions today, will help address that need in a meaningful way. There are many reasons why many people, such as foreign-trained physicians, choose to come live and work in BC. Our province has one of the most diverse populations in Canada. Currently, there are 4,451 international medical graduates practicing in BC, 2,570 of whom are family doctors. Expanding the Practice Ready Assessment Program, which we sometimes call PRABC, will simply allow us to welcome more internationally trained physicians who have completed their residency in family medicine outside of Canada to contribute their skills, experience, and training in primary care settings across BC. Family physicians who are seeking a pathway to full or provisional licensure to practice medicine in BC can apply to the Practice Ready Assessment Program. Those who are successful during the PRABC's assessment process will complete a 3-year return of service in communities of greatest need. This means more patients in rural and remote communities will have greater access to the high-quality care that they need, and in addition, underserved communities will be supported in a more significant way. The move from 32 to 96, a tripling of this program, is a major investment by the province in the future of public health care, and I'm very proud, and I know the Premier is, as he has been a consistent advocate on this question, are very proud of this approach. On associate physicians, the new associate physician class introduced by the College of Physicians and Surgeons of BC will allow practitioners with specialty training to contribute their skills and expertise while working under the supervision of a practicing physician until they can become licensed. This will help us increase capacity in high-need areas such as acute care. On the accreditation process, Premier Eby referenced the physician from Pakistan living in the interior BC, I believe, and talked about a physician in the Fraser Valley as well. It can be daunting to move to a new country without a guarantee that they will qualify to practice upon arrival. We can help change this by allowing doctors who are considering moving to BC to complete their assessments in their home country. By offering the opportunity to do the assessment before moving, we are removing this uncertainty and helping them feel comfortable as they plan their new life in British Columbia. Lastly, the changes that are being made by the Colleges of Physicians and Surgeons will make it easier for doctors in the United States to work in BC, to come and work here right away. This applies to doctors who are certified by the American Board of Medical Specialties and receive 3 years of accredited specialty training in pediatrics, emergency medicine, or internal medicine. This is extremely good news for British Columbia and reflects the commitment of the College of Physicians and Surgeons to help address some of the challenges facing our healthcare system. None of these changes would be possible without the collaboration and support of our partners at the Doctors of BC. They've been a key partner over recent years and months in building the path forward for a stronger healthcare system. And here on their behalf, we've had a few announcements recently, is Dr. Ramneek Dosanjh. I wanted to introduce her now to say a few words. Dr. Dosanjh.
Thank you, Minister Dix. I also want to acknowledge the land of the Coast Salish people that I'm getting to announce, and we are very pleased that the provincial government is making it easier for more U.S. and internationally trained family doctors to come to British Columbia and practice. This is something that Doctors of BC has long advocated for. We are all well aware of the very real challenges in primary care that have been with us for far too long. So any effort to address these problems is welcome. Patients and doctors need all the help they can get. Increasing the number of family doctors we will allow to come to British Columbia and practice, fully qualified doctors who have been dreaming about coming here but have only encountered roadblocks thus far, will not only support our existing family doctors, but will be beneficial for our patients, so many of whom are looking for someone to take care of them now. We welcome this component of a much larger action plan to address challenges with family doctor shortages and lack of patient access. And making it so doctors trained elsewhere can easily move to British Columbia is a great step. I also know in my own journey, I'm a U.S.-trained physician, and this is a much-needed relief to many of my colleagues looking to come to practice in British Columbia. BC's family doctors have made it clear to us that the challenges in primary care and that we are advocating on their behalf. Doctors of BC has been working collaboratively with the Health Ministry to bring about the changes to family medicine more appealing. Introducing the new family physician payment model is a huge component to strengthening the primary care in this province and improving the ability of foreign-trained doctors to come to British Columbia and practice is another critical component. We also know that all BC doctors face additional pressures, including administrative burdens that either take valuable time away from their direct patient care during the day or take valuable time away from their families in the evenings. We are advocating on behalf of BC doctors to address these burdens, to find better and more efficient ways of dealing with paperwork, charting, and electronic medical record components. We are also supportive and working with our government partners on changes to how primary care networks are working. So far, BC to admit more doctors in this province who are trained and have worked elsewhere in countries which we know the quality of the education and abilities of these doctors is a very crucial and important step, and we welcome it wholeheartedly. Foreign trained and experienced doctors are vital members of the BC's medical profession. Thank you very much for allowing us to be part of this celebration today.
Thank you very much, Dr. Desange. It's now my honor to introduce someone via Zoom, which I know is the favorite part of any presentation in this day and age. I want to introduce Dr. Ihab Fidel. Dr. Fidel has done his medical training in Qatar and some extra training in geriatrics in the United States. He is now a family doctor in Victoria after completing the Practice Ready assessment earlier this year. So I want to introduce Dr. Fidel.
Hello and good afternoon, everyone. Thank you to Premier David Eby and Minister Dix for inviting me to speak today. My name is Dr. Ihab Fidel, and I'm a family physician at the Arbutus Family Medicine Clinic in Victoria. I'm joining you today from the traditional territory of the Lekwungen peoples, especially the Songhees and Esquimalt First Nations. Today's announcement is great news for doctors like me, who were trained outside of Canada. I completed my family medicine training in Qatar and did also further training in the United States in geriatrics. I was interested in living and working in British Columbia because I wanted to live in a safe place with beautiful nature, a place where everyone is welcomed and respected. After doing my required exams, I came to Vancouver in April to begin the Practice Ready assessment, where I learned not only about the medical system in Canada, but also about Indigenous health and cultures in BC. I then moved to Duncan and worked under the supervision of a family physician for 12 weeks until I completed the assessment. In September, I started working as a family physician at Arbutus Family Medicine Clinic, and I'm very happy to be part of the team and to get to know the community and my new patients. This program fully prepared me to be a successful family physician in British Columbia, and I'm very glad to hear its expansion so that more doctors can live and build their career in BC, like myself. Thank you to everyone that made this happen. This is great news for doctors like me and patients alike. Thank you.
Well, and thank you, Dr. Fidel, and I think I speak on behalf of everyone here when I say that BC is lucky to have you, and that the expansion of this program and opportunities for internationally trained doctors to work and provide care, particularly in primary care in British Columbia, is an important change. It's been a valuable program, and it is going to get dramatically bigger over time. I want to say that this, of course, announcement is part of the government's Health Human Resources Plan, and particularly with as it relates to doctors and family doctors and the need for more doctors. You've seen significant change in the last number of months. We started new to practice contracts. 86 contracts have been signed under the new to practice contracts. Typically that number is about 20. That was put forward, announced, and implemented over the summer. In August, with Dr. Desange, we met and provided interim funding to support clinics throughout British Columbia. Interim funding that is close to fully subscribed a major and important new step. In October, we announced our Health Human Resources Plan that included 128 new seats at the University of British Columbia. Later in that month, we announced our new agreement with the Doctors of BC that fundamentally transforms primary care and improves primary care for patients and for those working in primary care and in team-based care in BC. It was a result of months of collaboration with the Doctors of BC. Today, and subsequent to that, we signed an agreement with the resident doctors of BC, an important component of the future of BC's healthcare system. And today we're making this announcement very much under the impetus of Premier Eby, who made this a fundamental issue for him going forward. And so, as you see over the last number of months, this announcement, one of the most significant for the future of the healthcare system we've seen, builds on a base of a series of steps we've taken in this period of pandemic and challenge for the healthcare system that will make a huge difference for people. So thank you very much for coming today.
Okay, so we heard from Adrian Dix and Premier of British Columbia, David Eby, on some significant things that they're trying to do to improve healthcare for the residents of British Columbia without actually, as they put it, resorting to a pay-as-you-go program where residents would actually have to literally pay out more money in order to get health care. As Premier Eby said, that such a program may not necessarily take away the lines, but it would enable a lot of line jumping. So we have to advocate for equality within healthcare, and we also have to advocate for more wellness, where people get treated as a whole person, mind, body, and spirit, and not just a treatment of a series of symptoms. So we'd like to see how the healthcare system is going to evolve so that becomes the absolute goal, instead of pushing for a comfort zone for ease of symptoms, that we find a way to make it so that the symptoms never actually occur. Thank you for listening, and please do find that subscribe button wherever you may see it, so that you can get continued updates from us here at Depictions Media Radio, and from this particular show, Policy and Rights. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.